It is happening again. Oh no, an uptick in COVID cases has forced 2 school districts in eastern Kentucky to cancel in-person classes. Now, the numbers are growing nationwide. I know you've heard about this, with hospitalizations now up more than 21% in just 1 week. The CDC expects that trend to continue into the fall. So let's check in with Dr. Celine Gounder, because she's got the answers, a CBS News medical contributor and editor-at-large for public health at KFF. Good morning to you, Celine.
Good morning.
I'm getting on a plane again. I'm thinking, where's my mask? Do we need to go back to that?
Well, I am myself hopping up on a plane tomorrow on vacation for a few days.
Yay.
I will be wearing a mask because, well, who wants to get sick while you're on vacation?
Yeah.
You know?
Nobody.
So I think if you are going to be in a crowded public place, the subway, an airplane, a crowded theater, those are the kinds of places I would at least consider wearing a mask.
We should clarify with that, with the schools in Kentucky, they're closing down not out of an excess of caution, that phrase we used to always use, but because they don't have teachers and staff, right?
They don't have enough teachers and staff to take care of the students at school. So people have a right to call out sick if they're not feeling well. And
Yeah.
I think, to prevent people from calling out sick, some of the things employers might want to do is have on-site vaccinations available to people, not necessarily force people to get vaccinated, but at least make it as convenient and easy as possible so that people aren't having to call out sick.
For some, when you hear the word booster, it could be a bit overwhelming because you don't know which ones to take. Some aren't even boosted in the first place.
Yeah.
So what's your advice? Is there certain boosters that we really need, certain boosters that are more important than others?
So there are 3 shots that are going to be available this fall. You have flu, COVID, and RSV. So RSV, if you're 60 and over, if you're immunocompromised, pregnant women, and then we have some options for infants.
Okay.
Flu, pretty much everyone.
Yep.
And then COVID, pretty much everyone will be eligible, but people 70 and over, those are the people who are landing in the hospital, and those are the people, like, as soon as the boosters are available, go out and get one.
But we keep hearing hospitalizations are up. What does that mean by up, and who is in the hospital?
So hospitalizations are up because COVID transmission is up, but who's actually getting sick enough to end up in the hospital? It's the elderly. So really, people 70 and up are driving most of that, almost the entire increase that we're seeing in hospitalizations right now.
And if you get COVID, I know someone that just got it for the first time after all this time, somebody else who's got it for the 3rd time. Do you still stay home for 5 days? What's the rule?
Well, no one, really, very few people are enforcing much of anything right now in terms of isolation.
See, isn't that a problem?
Well, in healthcare, I would say probably not a great idea because, you don't want to be infecting your patients. But if you're able to stay home until you test negative on a rapid test for COVID, that would be the ideal, but not everybody's able to do that.
Isn't this the point where we were supposed to get to, though, over the hump, where we're not as overly cautious? So if you get COVID and you're treating yourself and maybe you're boosted, you can still go out and handle whatever you need to?
Well, I mean, you're still infectious to other people, so you could still get other people sick. So it is still something to consider. If you have COVID and you know that, you probably don't want to go to a nursing home and visit an elderly relative, or to the hospital and visit somebody who's on chemo for some kind of cancer. So, I think the risk to each of us, if we've been multiply vaccinated, is pretty low, unless you're in that elderly age group. But you want to be thinking about other people too.
Do you see another lockdown coming?
Oh, no.
No, you think that ship has sailed?
That ship has sailed. Has sailed for years now.
Okay.
Well, we will end on that note.
I feel better.
Yes, we all feel better. We appreciate you coming by.